This is Veteran Oversight Now, the Veterans Affairs Office of Inspector General official podcast. I'm your host, Louis Calderon. Jennifer McDonald, Director of the Community Care Division for the Office of Audits and Evaluations, testified on June 11th before the House Veterans Affairs Subcommittee on Oversight and Investigations. Her testimony focused on how VHA's pause of its program integrity tool affected community care revenue collections and oversight operations. Dr. McDonald discussed how data integrity and accuracy issues limited VA's ability to use the tool to identify fraud and waste and could potentially lead to veterans receiving bills for co-payments more than a year after treatment. In response to questions, she highlighted the OIG's work related to VA's electronic health record modernization and supply chain improvement initiatives as examples where poor planning and cost estimates have affected the effectiveness of newly deployed systems.
IT modernization has consistently been a major management challenge for VA. Our work has identified extensive breakdowns with upgrading and replacing key systems, as well as significant cost overruns. The OIG remains vigilant in overseeing all significant IT initiatives to identify all risks to veterans, their families, and survivors. To do this, IG staff monitor programs and operations for breakdowns in processes, for noncompliance with mandates, for failures to provide timely and quality health care, and for deficiencies in the delivery of benefits and services to veterans. We will continue to advance accountability by conducting effective oversight into how VA plans, implements, and remediates identified weaknesses in its system modernization efforts.
Meanwhile, 10 OIG investigations had updates in June. This includes a multi-agency investigation resulting in charges alleging that the founder of a purported charitable organization and 4 of the charity's employees defrauded both VA and veterans in connection with a pension benefits fraud scheme. The defendants allegedly misled veterans by advising them that they were eligible for pension benefits to which they were not actually entitled. On the veterans' behalf, the charity submitted falsified supporting documentation to VA in support of their pension applications. Once the applications were approved, the defendants either demanded direct payment or a large percentage of the resulting benefits before releasing the remainder to the veteran. VA allegedly paid over $20 million as a result of this scheme. The charity, the founder of the charity, and the 4 charity employees were indicted in the Cuyahoga County Court of Common Pleas on various criminal charges related to this scheme. Another VA OIG investigation resolved allegations that a nationwide medical device company fraudulently overcharged VA and other federal agencies for medical device hardware and software products. The company held a federal contract to sell and lease products to VA and other federal agencies at a set price or a negotiated discounted price. The company allegedly sometimes sold and leased products to the agencies at a price higher than the applicable contract price. While the company at times issued credits or corrected prices charged to VA and the other federal agencies for specific orders, they did not correct the known issues in their sales and pricing system in a systemic way. The company also allegedly did not work to determine whether the federal agencies were previously overcharged and should have received refunds. The company entered a civil settlement in the Eastern District of Washington, under which it agreed to pay over $4.3 million to resolve allegations that it violated the False Claims Act. VA will receive over $2.1 million of this amount. The OIG published 9 reports in June. An OIG evaluation of VA's governance of recruitment, relocation, and retention incentives for VHA positions found that the incentives were used mostly to address staffing shortages. However, VA did not effectively ensure VHA officials consistently captured mandatory information to support incentive awards. An estimated 30% of incentives paid during fiscal years 2020 through 2023 were missing forms, lacked sufficient justification, or were missing signatures. This resulted in more than $340 million in incentives that were not adequately supported. The OIG team also estimated VHA did not include sufficient workforce and succession plan narratives for 20% of retention incentives, note employee performance ratings for 7% of relocation incentives, or obtain self-certifications for about 71% of employees who relocated. The team identified 28 employees who received about $4.6 million in retention incentives after the award period had expired. The OIG made 8 recommendations to improve oversight of these incentives. Other OIG reports published in June included 5 healthcare facility inspection reports. The OIG's Healthcare Facility Inspection Program reviews VHA medical facilities approximately every 3 years to measure and assess the quality of care provided in these 5 areas: culture, environment of care, patient safety, primary care, and veteran-centered safety net for vulnerable populations such as those served by homeless programs. June's Healthcare Facility Inspection reports examined facilities in Georgia, Missouri, Oregon, West Virginia, and Washington. The OIG issued 15 recommendations across all 5 reports. We also published mental health inspection reports on the VA Salem Healthcare System in Virginia and the VA Philadelphia Healthcare System in Pennsylvania. The OIG's Mental Health Inspection Program evaluates VA's continuum of mental health care services. For these 2 reports, the OIG evaluated acute inpatient mental health care across 6 areas, including leadership and organizational culture, suicide prevention, and safety. The OIG assessed processes in each of these areas and identified successes and challenges that affected the quality of care on the inpatient mental health units. The OIG issued 20 recommendations for Philadelphia and 15 recommendations for Salem. Read more about the VA OIG's oversight work in June 2025 on our website at vaoig.gov. Want to stay up to date? Sign up to receive email messaging from the VA OIG. Thanks for listening.
This has been an official podcast of the VA Office of Inspector General. Veteran Oversight Now is produced by the Office of Communications and Public Affairs. Tune in monthly to hear how the VA OIG serves veterans, their families, and caregivers through meaningful, independent oversight. Report potential crimes related to VA waste or mismanagement, potential violations of laws, rules, or regulations, or risks to patients, employees, or property to the OIG online at vaoig.gov or call the hotline at 1-800-488-8244. If you are a veteran in crisis or concerned about one, call the Veterans Crisis Line at 988, press 1, and speak with a qualified responder now.